Hospice is not just a service to the person with the diagnosis, but it's a service to the caregiver. A lot of caregivers try to take care of the needs of their loved one on their own for a very long time with very little help. And it not only takes a toll on you as the caregiver, but it does take a toll on the person with dementia, because as much as you may try to hide the fact that you are stressed and you are worn down, they are going to sense that you are having a hard time dealing with the disease. It's common for someone to feel depressed, feel hopeless when they're caring for somebody with this disease. When you bring hospice into the picture, again, you have an extra set of hands to help you with all of those activities of daily living, helping them with bathing, helping them with dressing. You have an extra set of eyes. You have nurses and doctors attending to their needs and able to see that there are changes happening and address those needs as they happen. For you as the caregiver, you definitely need as much support as that person with the diagnosis, emotional support. They have clergy, they have social workers that you can talk to that can help you to find support groups or just somebody to talk to during this whole process. Palliative care is a bit different than hospice. Again, there are criteria that need to be met, just as there is for hospice. Palliative care will treat the primary cause of the need, whether it's dementia diagnosis, whether it's cancer, but they will not only treat the symptoms and keep them comfortable like they will with hospice, but if that person does become ill with another illness, or they do decline at a rapid rate, rather than keeping them at home and keeping them more medicated, they will send them to the hospital at your request. So there is a bit of a difference. Not all areas have a palliative program. Hospice is found everywhere. The good thing about hospice and palliative care is that most of the programs are very willing to work with you and your needs and your beliefs. So if you feel that your loved one is being too heavily medicated, you talk to the nurse, you talk to the doctor about it, and they may either cut back on medication or they might find another way to medicate them to keep them comfortable. One of the things that I suggest to all the caregivers I've ever met is when you have a loved one who's had a hospital stay and the doctor or social worker has talked to you as the caregiver about the possibility of hospice. Sometimes it is just natural for the doctor or the hospital to say, well, let's admit them to the hospice unit here in the hospital. I strongly recommend that for you as the caregiver who has kept your loved one at home as long as possible, that you don't immediately turn them over to the hospice unit. Of course, if it's an unsafe for your loved one to come home and they are unstable, then maybe the hospice unit at the hospital is a good choice. But if they are being admitted to hospice simply because they have declined, but it's not a danger to bring them home, and along with the assistance that you get from the caregivers that are assigned to the case from hospice, the care that they're going to get from the nurses, then I strongly suggest that you ask to have hospice services at home. Your loved one's going to be back in their own environment. You have more control over when those hospice workers come to the home. You can let them know what help you do need so that they are there when you need them. And just because the service is being provided at home doesn't mean that that needs won't be attended to immediately if needed. So if your loved one has declined and you're worried about what's going on with them right now and maybe there's nobody there from the hospice company at the time, you can reach them 24 hours a day, 7 days a week, and someone will come out, someone will talk to you, someone will come out and take their vitals and find out what's going on, what is the cause for your concern. So hospice in many ways is not something to be scared of. It's something to, I believe, embrace and look at as a blessing for the one in your care, but also for you as the caregiver. Thanks for watching, and I hope you'll join us again for more caregiving tips.